So, good morning, everyone. My name is Shazia Khan, and the unit that we're doing today is Principles, Values and Regulations in regards to the health and social care sector. So that's the unit we'll be covering today. Is everyone on the right unit? That's the first thing.
Yeah.
Yes,
Yeah.
excellent. And then it's an ATHE unit, and for this unit, we'll have 3 learning outcomes. Okay, so we'll have 1 session tomorrow and then 2 next week as well. So we've got learning outcome 1, 2, and 3, and then we have an assignment discussion session where we discuss your assignment with you in more detail and support you in finding out where you can get some of the information to complete the assignment. So that would be the last session. So you've got 3 learning outcomes and the assignment discussion session. So on the screen here now, I'm just showing you the assignment brief, how it looks. It's on Moodle. It's available for you when you go onto Moodle, and this is how it looks. It's got the unit details. It's got the ATHE, the awarding body, and then it's got the assignment brief there. So task 1, task 2, task 3, and it looks at the extension activities, what you can gain to get that. Okay, we'll look at that more in the last session. I'm not going to go through it today with you. I'm just showing you how it actually looks for you to get it on Moodle. Okay.
Okay.
So this is just guidelines and things, but it's all there for you to get on Moodle. But
Yeah.
we're going to go through this in more detail so you have a better idea of what we're doing in the last session. Okay, so firstly, because it relates to the 3 learning outcomes, we need to go through them first. Okay,
Okay.
so let me just share the slides with you, and then we can have our session started. So can you see the slides, everyone? So the learning outcome we're doing today is learning outcome 1, which is to understand current policy on health and social care. And when we talk about policy, I know it's a bit, why do you think policy is so important? Why do you think having policies within health and social care is so important? Why do you think it's so important?
Sorry.
Any sort of policies, why is that policy so important within the health and social care profession? Deborah, why do you think policies are so important?
Yeah, it guides us on on the principles on what to
Excellent.
do
It
and
is the
what not to do.
principles, yes. It is
Yeah.
the principles, Wadi. Is it Wadi Nobi? Yeah? Is that right? Am I
Yeah,
saying?
why didn't
Yeah,
it be?
excellent.
Yeah, why didn't
Excellent.
it be?
So policies, guidelines, it's there for us, supporting us lot as individuals, okay? So
Yeah.
in this session, the learner will understand current policy. So we'll look at 1.1, which is to identify current government policies related to health and social care in your chosen country. We look at 1.2, which is to explain the impact of policy on health and social care sector and on the provision of care within your chosen country. We'll also look at 1M1, which is the merit one, assess how policy meets the current needs of the population in terms of health and social care. So policies and procedures are really important within any organization, and understanding policies and procedures are even more important. So policies can be split into 4 different care sectors, 4 main groups: administration, which deals with things like the admin side of it, data protection, GDPR; the health and safety, which looks at fire safety and lone workers; human resources, which looks at HI, qualities, diversities. It looks at elements of grievances, any disciplinaries; and then service delivery, which looks at adult protection, complaints, suggestions. So to firstly understand policies and procedures, why they're so important. So current health and social policy on the UK focuses on, different improving, the life and, improving the management of health and social care. And it's there to promote and protect the interests of patients, service users, and make sure that, everything is in place, because, having policies in place within the health and social care is important because it governs what we're supposed to do. So, if you have to keep safe, you've got to have policies in place to help you keep safe. And are we abiding by the law by doing this?
Yes, we are.
We are. And the law may say to us that you've got to have it does say to us you've got to have a safe environment for people to work in. We've got to make sure that that environment is safe, because if we're not, are we breaching the law?
Yes, we are
Yeah,
breaching the law if we're not.
yeah. So, make sure everything is in place, make sure that the health and safety guidelines are in place, make sure we are following procedures, make sure that, we understand that the procedures that are in place. What kind of procedures can be put in place, Deborah?
Pardon, sorry.
What kind of examples of policies and procedures can be put in place?
Mm. Ah, I didn't get it. Sorry, I didn't find.
So, in your workplace, there
Yes.
must be policies and procedures in place. What kind of policies and procedures are in place for what kind of things? So we've got the first one we mentioned, health and safety. What else?
Um, um, like protecting the service user.
Yeah, protecting the service users. Good, yeah. What about
Safeguarding.
Nawadi? What do you think? Elizabeth, is there anything that you think that can be any examples of areas that may be covered under policies and things?
Okay, let's say medication administration.
Yes. Why is that
Um,
important?
because different service users have their own care plans and
Yes.
different diagnoses, so you have
Yeah.
to know what exactly, and
Yeah.
sometimes you need to know them by their names, and that's
Yes.
why we have to
Excellent.
put
Excellent.
all that in there and all.
Yeah.
Yeah.
Is confidentiality important, a policy to put in place, Nawadi? Being confidential.
Yes,
Yes, why? Protecting what? What are we protecting?
we are protecting the service users. We are protecting their image, their data, and
Yes, excellent, excellent. So it's really important to have these policies in place. So number 1.1, identify current policies relating to health and social care within your chosen career. So we have the Department of Health and Social Care, DHCS, that deal with responsible for any sort of adult and health and social care matters within the UK. And they are there to oversee any sort of elements of the NHS that deal with anything. And if there's any policies or anything in place that they don't deal with properly, they are there for providing guidance for delivering a satisfactory social care system. And their main objective is to provide care that is equal for all and retaining their independence, control, and dignity. So they make sure everything is put in place. The department develops guidelines and improve the quality of care, as we said, and it works through arm's length bodies. And it works with executive agencies such as the health, security, medicine, and healthcare profession. And they work together to make sure that they're delivering an equal service for everyone. So we're going on to legislation now, and we talked a little bit about the importance of legislation, why legislation is so important, in our area, and why we should follow it. Why do you think legislation is so important? Why do you think having laws in place is so important?
I feel like there are legal guidelines to
Yeah,
how things are done and how they should be done. So, and it should also be more like a regulation
yes,
across
yeah,
borders,
yeah.
so you don't
And
make mistakes.
some people don't follow them, do they, Elizabeth?
I know,
Yeah. Some people don't follow all the health and safety regulations, all the laws that are in place. That's why, we have elements of grievances and we have elements of things that breaching the law. The first one we're looking at is Health and Social Care Act 2012, which is a landmark piece of legislation that aimed to reform the NHS, introducing a new structure with greater local control, increased accountability, and focus. The main focus was on patient choice and quality of care. And this act addressed public health, social care, and the regulation of health and social care workers. Okay, so it looked at elements of that and it looked at changes. And one thing I will say is, and I know some of you have had me before, but I don't really read off the slides as much. I tried to give you extra stuff that you could work on. So is that okay with all of you? So I don't want to be really
It's,
reading off the slides. I
Yeah.
want to kind
it's
of
fine.
Yeah, that's fine.
Yes, it's
I want
good.
to try and give you a little bit more so we can work together, okay?
Yes.
The next one is the Equality Act, and again, this is really important act, and it's there to look at protecting you as an individual. Why do you think the Equality Act is so important? What do you think it's there for?
I think because we're people of color and different
Yes.
cultures and
Yeah.
backgrounds,
Yeah.
so that needs to be put in place so
Yeah.
that we also respect our boundaries,
Yeah.
and also safeguard ourselves
Yes.
as well.
And it's a good act to have in place because it protects you from any sort of discrimination, any harassment in the workplace. And it looks at elements of, it has protected characteristics in it. This act has 8 protected characteristics. It has age, disability, gender reassignment, marriage, civil partnership, pregnancy, maternity, race, religion, or belief, sex, and sexual orientation. And these are protected characteristics that fall within this act, saying that no one can discriminate against you within them. So it does happen, discrimination does happen. And I will say that because, I worked in my workplace for the last 18 years and things have happened that shock you, but that's how the world works. Um, the next one is supporting legislation, and we've got the Social Act and what that does. So it is the element of it looks at things in regards to your economic, social, and environmental well-being. And it creates this social element of, the Health and Social Care Act, but it is also there to look at the NHS and its responsibility to patients and the community. And making sure that everything is right, because sometimes, like we said, there's been breaches of the act. This act requires public authorities to have regard to things like your social, economic, and environmental well-being in connection with like public services contracts and connected purposes. So it's a really good act to have in place. The next one is policies in health and social care, why they are so important. So, it's vital to have these policies in there as a guidance, when we mentioned earlier, to help you make decisions. And the purpose of this is to communicate to employers. Employers need to know these policies. Why is it important for you to know these policies? Deborah, why is it important for you, firstly, and then I'll go through Wadi and Elizabeth. Why do you think it's so important for you to know about these policies, and you've read these policies, and you know why is it so important for you to know about these?
To provide good services.
Yes. But is it also about protecting yourself as well, Deborah?
Yes.
Excellent.
It's about you protecting yourself, so you
Yeah.
actually know the guidelines and
Yes.
way to go about grievances, and not
Yeah.
just being like you're always complaining, but
Yes.
also know the legal things that are binding.
Yeah.
So you know how to fight
It
for
could be
yourself.
it could be things like, for example, manual handling, the way you pick something up. If you're using a hoist, there needs to be policies in place and guidelines in place on how to use it in case you hurt your back, in case you
Yeah.
do anything like that. So health and safety. Why is it important, Nawadi? Why do you think it's so important to follow these procedures and policies?
Um, I would say it's important to follow the procedures and policies so that you won't be found wanting in or in any in, a- in
It
any
could be that the fact that you follow them, that you're not doing anything wrong, and you're following them correctly, and still things happen. So there are policies in place, and other government policies that affect the provision, health and social care, economic policy, which covers elements of tax, Labour market and government intervention, they are policies that are in place. Another one, a really important one, which is things like immigration policy. That is has significant implications on health and social care. And it could be the restriction on overseas recruitment of care workers. It could be, the fact that you may not be able to get NHS treatment. It could be increased salary thresholds. It could be aimed at managing migration. So it could be elements of the government might encourage more domestic workers to come in. So, immigration, I don't know if anyone else thinks it does play a big part on the health and social care profession. If you allow nurses to come in from different countries, does that have an impact on immigration policy? Elizabeth, what do you think? Do you think, immigration plays a big role within the NHS or the health and social care profession?
Well, it does, to my own understanding,
Yeah,
because with everything comes with you having to pay for certain things.
yeah,
And
yeah,
sometimes because we're not, part of the system, we're trying to get into the system. That is more like we're paying our way through getting everything
yeah,
that we're supposed to
yeah.
get for
It's
free.
difficult because I teach immigration law on the degree level course, and I just feel like it's difficult for people to come into this country and not be, you have to pay for your surcharges and your medical surcharges, and a lot piles on. I know it does have an impact on bringing people over and, making sure they work and seek work here, but it does affect the people because they have a lot of costs involved in immigration as well. It's not something that's straight, forward. It's not something that, you can just come into the country as you want. There are requirements and v of the visas, and trying to make sure you implement them is difficult sometimes.
It might
1.2,
be easier if maybe one can have certain like benefits, but then
yeah,
again,
yeah,
because we're immigrants, we don't
yeah,
get any of that. So
yeah,
it's
yeah,
difficult to also manage
yeah,
with family and
yeah. Especially when you have children and stuff, it's
yeah.
difficult. Having to pay the children's, dinner and things like that. They should. Immigration's been a huge problem in the country, and it will still be an ongoing problem. They're making it more stricter. So 1.2, explain the impact of policy on the health and social care sector and on the provision within your chosen career, so your chosen country. There can be many impacts that a policy can make on provisions, such as provision of facilities, staff, and services. So it could be, policy changes are there to put into place and make sure, your changes, can be done to maybe things like the public health, it could be the workforce, it could be challenges of services as well. Are you all okay? Is there any questions anyone wants to ask?
I'm okay.
Okay, thank you, Deborah. And
Yes, fine.
Elizabeth, you okay?
Yes.
Okay, so we have the provision of facilities. So we have the welfare facilities, and within the welfare facilities, we have workers must have access to the services, toilets and basins, and workers should have access to a place to clothe themselves, drinking water, somewhere to rest and eat meals. And that is within the Health and Safety at Work Act 1974. And people need to have these places because there needs to be safety for them. There needs to be sufficient lighting. It's not just for the patients or anything else. It's for the actual staff themselves as well. They need to work in an environment within the Health and Safety Act that is safe for them to work in. There's lighting, there's space, there's temperature, the ventilation, drinking water, accessibility. This is so important for employers to have. Some employers don't do it, and I will be honest with you, it causes a lot of problems. That's why there's loads of cases of discrimination, but it needs to be put in place within health and safety regulations. A healthier workplace, because working environment, so good ventilation, like I said, a reasonable working temperature, lighting, enough room to move around, a clean workspace, waste containers, it should have everything in place. But do most organizations have all these things in place?
Most of them do.
Most
Some don't.
organizations do, because why did they have to follow the law, don't they? There are some of the
Yeah, they
Well,
small,
have to.
they do follow the law, but
yeah,
then again, there comes a bit of discrimination
yes,
because something happened at my workplace of late whereby
yeah,
it was more like it wasn't the security that came, but the internal inspectors that come,
yeah,
and there was one of the staff was warming up a food
yeah,
in the servery, and I think it smells of fish. And
yeah,
the inspector was like, I can smell fish, I can smell fish. And the other one was like, oh, I can smell anything. And before we knew it, it became a report. We got
yeah.
reported for it, and it said, oh, now all staff have been banned from warming up the food on the ward and even eating the meals on the ward.
Oh God.
Yeah, it came as a shock to
Yeah,
everyone. But
yeah,
then again, I'm like, okay, in my head, I'm like, okay, they've got their bland food in which we don't really like. Now we bring our own. Yes, sometimes
yes,
I wouldn't lie, it's a two-way thing because sometimes some of our food have strong smells. You get what I
yes.
mean? Like it's really strong.
Like maybe like the spices and stuff,
Exactly.
Yeah,
But then again, I didn't want to take it to heart because then I was like, okay, it might be offensive to some people because these are service users. It's not really our space. So
yeah,
maybe the mistake that was made was if the food was warmed somewhere else and
yes,
you come to eat in the ward. So
yes.
it just goes both ways,
Yeah,
really,
it
to be
does.
honest.
Yes, you're right. Yeah. And you feel a bit upset as well, thinking that I can't bring in certain food.
Exactly. So
Thinking, yeah, so it does have an impact on it, but it shouldn't. You should have your own space. So explain the impact to safe workplaces to maintain the premises are safe. Make sure that there's nothing around that you'll fall on. Making sure boxes are moved, windows are opened, and make sure the walls are protected of safety material. Making sure you've got work material that is around your a table that is safe as well. Um, then you've got the Employment Act, so we look at the provisions within these legislations. The Employment Act is a piece of legislation that outlines the rights of you as employees and responsibilities as employers. So it covers a range of employment issues such as contract, working hours, unfair dismissal, and redundancy. Then you have the National Minimum Wage Act, which sets out the minimum wage in the UK, and it legally requires employers to pay the workers over school leaving age at least the minimum wage. And the act it actually established the Low Pay Commission to advise on minimum wage rates. So it sets out your hourly rates. We then have the Employment Relations Act, and this act outlines details on employment rights in work, for right of accompaniment, for disciplinary and grievous hearings, amongst other laws as well. And then you have the Part-Time Workers Act 2000, which is this should not be any worse than any full-time worker, a part-time worker, including things like holiday pay, sickness. They should be treated the same. Absence, maternity leave, adoption, parental leave. So it looks at the element of protecting people that are part-time workers that won't be treated less favorably. Then again, the Equality Act, which we looked at, is from trying to prevent anyone from any sort of discrimination, even if it's in recruitment. And it looks at the element of, the protected characteristics, making sure everyone is paid equally, make sure that everyone is treated fairly without any forms of discrimination, which in some organizations still occurs. Then we have the commissions of services. And the Commission of Services is accordance with the Health and Social Care Act 2012. And this is it looks at the Act introduced duties on commissioners to involve patients in decisions about their care and to promote equality and reduce health inequalities in this. So it was an act that was introduced to make sure that the NHS oversees the commissioning and oversees any sort of specialist services like primary care and public health services. And it is all about patient choice and control over their own healthcare, making sure that they've got control over their own healthcare and they choose who provides their care and treatment because, that's important for the individual. So the commissioning of services was implemented by the NHS under the Social Care Act 2012. And the commissioning comprises a range of activities, is like we said, assessing the needs, planning services, procuring services, and monitoring quality. And that diagram looks at the element of that. And it looks at, the NHS. This element of commissioning was introduced in the 90s in the UK, and it was part of the broader NHS reforms, and it separated the services. So, assessing needs, like we said, planning services. Why was there need to separate the services? What do you think? Why do you think there was a need to separate these services?
Because there are different diagnoses for different patients and also their services, and also depends on the level of risk as well.
Yeah.
They need to separate.
They had to separate these services because they had to make sure that the whole point of it was, the purchasing was different, the assessing needs were different, and it was argued that, if they separated them, there was greater efficiency and responsiveness and innovation. So there was a need for it. It wasn't that they wanted to do it, there was a need to do it. So the concept, like we said, was in the 1990s. And it was argued that there was a need for this to happen, and it created the NHS and Community Act 1990 created an internal market and a purchasing provider split in their purchases, and it gave them their own budget. So it gave them their budget to, maybe spend on assessing needs, planning, prioritizing. And, it was really important to have this in place because, like you said, Elizabeth, everything was done separately. Each department had to do everything separately. So there was a need for that to come into place and make sure that, everything was followed. People were doing everything right, and it was to reform the system. And it had to be reformed because of the element of, making sure that it was an effective service, making sure that, that diagram, everything was separated. And it was introduced mainly to provide everything separately. So there was no longer one service that provided the same organization. And the whole point of it, the separating the purchasing function allowed better assessment of population needs, more efficient planning allocation, more efficient allocation of resources, and it was, it was introduced to make sure that there was a shift in transactional models to make sure there was collaboration between the different services. So there was a need for it to happen. So 1M1, assess how policy meets the current needs of population in terms of health and social care. So here you need to carry out an assessment and comment on how well the existing policy needs are met, for example, infrastructure, funding, inequalities. So current social and health and social care policies, there are challenges that they are facing meeting the population due to factors of things like maybe age, population, workforce shortages. So these policies, there's a need for them within health and social care. There's a need to implement these policies and have this infrastructure in place. So the first one we look at, just let me go back to the slides. Why is the slides not moving? Sorry. Infrastructure in health and social care. Is the key pillar and the fundamental element of it, and it encompasses things like, physical facilities, equipment, and systems that support the delivery of health and social healthcare services. So it could include buildings, it could be technology resources that enable hospital, clinics, and other healthcare professions to function effectively. And well-developed healthcare infrastructure is crucial for delivering this high-quality care, improving patient outcomes and the well-being of both patients. Is infrastructure, when we look at infrastructure, is there a need to have it within any health and social care profession? If it improves services, improves lives, improves elements of that. Do you think there's a need to have it?
Yes.
Yeah.
Yeah.
If we're improving, the well-being of patients and staff, and hospitals, and making sure everything is essential for providing this equipment, technology, is there a need to have this infrastructure in the health and social care?
Yes.
Yeah.
Yes. It's
Why do you
necessary.
think it is important, Wadi?
I would say it helps improve the lives of the patients,
Yes.
and sometimes also
The staff as well,
the
making
staff. Yeah.
sure it improves quality of life, improves quality of care,
Yeah.
enhances efficiency. Deborah, what else do you think, Deborah?
To have a proper documentation.
Yeah, proper documentation in place. Patient safety is really important when it looks at infrastructure. Staff well-being, the economic growth, the financial sustainability, staff, because not just patients are important, staff are important as well.
Mm.
Yeah.
So the infrastructure is there to integrate into the hospital, show, like we said, effectiveness of patients, making sure that everything is in safety, improving public health, making sure that increased public trust, because some people don't have trust in the health and social care profession. So having infrastructure in place, introducing new IT technologies, implementing new logistics, making sure there's new medical equipment in place, improves the infrastructure, and people have more faith in the system then, because they don't have that much faith at the moment. Well, because the fact is that they may not have, employers may feel, staff may feel that they don't have enough, they don't have the provided, like, they may
Support
not have
needed.
enough
Yeah.
support in place. So, equipment, make sure the physical hospital facilities are improved, making sure you're financial sustainable, there's economic growth, there's jobs available, the infrastructure is really good. So these kind of things will element on the infrastructure. The funding part of, why is funding so important within the health and social care profession? Why do you think funding is so important?
Yeah, I would say it keeps the system running
Yes, it keeps the system running, yes.
financially. Yeah.
Yeah, keeps the system running, it keeps the budget for the health services running, it keeps the day-to-day operations of the health and social care element running, and its budget includes things like revenues, income tax, pay, making sure that your adult is funded by, different elements of that is really important when it comes to funding, making sure the needs and entitlement is met. The funding needs to meet the total cost of the care. Social care is provided, with individual funding, and NHS is the general funding. The public NHS comes from general taxation and national insurance contribution, and it's for patient charges, for service charges, prescriptions, all this. So it's very important when we come to look at the financial side of it. The revenue comes from central government funding through the local government finance, and local raised revenue from business rates, council tax, but it's really important when it comes to the NHS that funding is playing a big role, because it can't run without funding,
No, we can. Yeah.
no. Health inequalities. So we have health inequalities, differences. What is health inequalities? What are health inequalities within the NHS? What does it mean to you?
That's lack of just like the slide says, lack of training for staff.
Yeah, lack of training for
Uh,
staff.
lack of would I say social
Yeah,
sorry, lack of
yeah.
infrastructure. Sorry,
Infrastructure, yeah.
like
Is it?
Lack
teaching.
of funding.
Sorry, what was that, Deborah?
Yeah, lack of funding.
Yeah, yeah, lack of funding, lack of, again, it could be
For me,
experienced by,
I feel
sorry,
unfair and, like more like avoidable differences between you and the organization.
Yes, yeah.
It's
It could be
just,
that, some people training for staff, some people are not sent on the training for staff and others are. Within health and social care, health inequalities are experienced with people from different range of backgrounds as well, isn't it? It could be, people that, have inequalities where they're not treated fairly. And it could be between
Yeah.
groups of people. It could be that, one person is being sent to a training course and the other is not being sent to it.
Yeah.
Inequalities today is, there's within health and social care nowadays is, they try to avoid it. It's unfair and avoidable differences. So it could be, how likely, the health. Sorry, what's that?
Not promoting someone
Yes.
when necessary. Yeah.
Yeah. It could be, people from different cultures, couldn't it? It could be the fact that they're not treated properly, where, it happens in the health and social care, the disparity in health inequalities does happen. It could be a group of people that they're not treated fairly. It could be, that it could be people from a deprived area, someone of
Yeah.
lower income, someone of fewer years of education. These are inequalities that happen within the health and social care. It could be the differences, it could be socio-economic costs to both, individuals and societies. So it could be like it says there, some of the ways that are addressed is things like training for staff. How would training for staff be an element of health inequalities, Wadi? You mentioned training for staff. Why would that be an inequality?
Yeah, I would say if staffs are not trained, it's going to affect the performance
Yeah.
given to the service users,
So
and
give me an
also it's
example
not
of where someone may not be trained in an area.
like um how do I okay, like take for instance
Yes,
trainings like this are supposed to be sponsored by our organizations.
yes,
So if we don't get trainings like this, we won't be able to know how best to satisfy our service users.
yes, you're right,
And
100%.
in doing so, most of us won't also be able to gain promotions. We
Yeah,
still remain on the same level.
I think sometimes it's all about the skill set when it comes to an organization. So sometimes some people are more empowered, whereas some people feel left out because you don't
yes,
have the training for it. And sometimes people like that are sometimes overlooked because they feel you don't have the potentials to complete the task you're given. It's not
yeah,
like you don't know how to do it, but because you're not properly trained, then that's where self-doubt comes in. And you're like, oh, what if I do it? And because I'm not being trained on it, then I get into trouble, I get faulted because I've gone to support or help.
yeah,
It
yeah,
just
yeah, it does play a big role. What about accessible appointments? Is that inequality in regards to people getting appointments? Why is that an inequality, health inequality, accessible appointments?
yes, that also plays a big role because some people have got benefits
Yeah,
more like it comes when it comes to dental care
yeah,
and all that. So, those people are the first people at the that more like it's more like they treat us like triage. So
yeah,
if you don't have NHS benefits, the first thing is, oh, you don't have benefit, or you have to pay for this, or you have to wait in line before you
yes,
can
yeah,
get this treatment. Whereas people that already have these benefits, all they do is just ring the number and they
yeah,
book an appointment. But you would have to wait in line for you to even get an appointment. Even if you get it, it's not for free. You pay for it.
yes, yeah. Training for staff, and it could be things like access mobile clinics for remote areas. They don't provide them. They should be providing them, but they don't. Health campaigns and care navigators to inform, advise, direct of service users as well. So, so today we've looked at just a summary of what we've looked at. We've looked at current government policies related to health and social care in your chosen area. We've also looked at the impact of policy and why it's so important within health and social care. And then we've looked at how policies meet the current needs of a population in terms of health and social care. Has anyone got any questions before we finish the session today? Wadi, Elizabeth, Deborah?
No
No, no
questions
question.
from
No, no
my end.
questions. Thank you.
No. Elizabeth, have you got any questions or anything?
No.
No.
I'm all right. Thank
Okay,
you.
so some of these resources that we've used for today's session are just listed there. And these resources can help you and support you when it comes to doing your assignments. So you can just link on them and just open the hyperlink. So you've got the Future HSC, you've got HRA NHS, you've got Department of Health and Social Care Wikipedia, Economic Policy Financial Definition, and you've got workplace facilities, which you can right click and just open them up. You've got a list of employment laws in the UK, and you've got what is commissioning and how it changed. So you look at the 1990s, and you've got the infrastructure as well of the health and social care. So we've finished this session today, which is learning outcome 1. The next session is tomorrow, which is learning outcome 2, which you will attend tomorrow at 11 o'clock. If you've got no questions, we've finished the session today, and thank you for attending today's session, and I'll see you all tomorrow.
Thank you very much.
Thank you.
Thank you.
Thank you. I'll see you all tomorrow. Thank you.
All right.
Thank you. Bye.
Bye.
Bye.